Okay, good afternoon. Thank you for attending our weekly COVID discussion. And right now, I think we have 51 people online on this Zoom call. So we thank you for participating. We've got a presenter today who's going to talk to us about childcare. But for those of you who haven't been on one of these calls before, please use the chat feature. If you have questions that come up during the presentation or things you want to share, we will open it up for conversation as well if you want to unmute yourself to talk about things. But what's worked best in the past is simply typing in your questions, and then we can get to them in order. So we're very pleased today to have Stuart Depew, who owns Mom's Best Friend, as well as College Sitters with childcare operations in Austin, Houston, San Antonio, Dallas, and Fort Worth. An attorney by trade, Stuart has 26 years of experience in the childcare industry. Stuart lives in Austin with his wife and 4 children. So we've heard from the very beginning that childcare has been a huge issue for our members, particularly since basically all school systems have been shut down across the state for the last 3 weeks at least. So, and probably for the rest of this school year. So we're going to have Stuart talk about his company, what he does, about what things people should consider when providing childcare, maybe on their campuses. So I'm going to turn it over to Stuart, and let me oh, you did unmute yourself. Okay, go ahead.
Great. Good afternoon, everybody. Thank you so much for having me on this call. And I love the video. I know we're not all able to see each other, but thank you so much for this time. And like we're talking about, we're all dealing with significant issues, being home, working with our kids. And I wanted to share with you some solutions potentially of providing childcare to your workers. So specifically, you have workers that are coming on site who are really struggling. Their kids are at home, either because they're in school and doing online school at home, or they're in a daycare center which has been closed. And so what I wanted to throw out was some ideas of what we could potentially do to help them. And specifically what my company does. So my company has several hundred professional sitters that are our employees. So we're a staffing company specifically in childcare. And we send these folks out to individual families' homes. Normal times, when we're not in coronavirus time, probably the majority of our business is still going to be backup care related. But right now, probably 95% of our sitters are going out to the home of healthcare workers, basically taking care of them while they're going to the hospitals. So that the hospital districts in Houston are significantly busy for us right now. And just really people that can't telework, that are going to be working in the hospital, and we're taking care of their kids at home. We're also taking care of some folks who are teleworking at home, but that's probably not so relevant to here. Another piece that we can do, and we've done previously during Hurricane Harvey, is build pop-up daycare facilities. So we did during Hurricane Harvey build on-site daycares at multiple hospital campuses across Houston, but we found that people are not really interested in doing that. Parents are concerned about having their kids be around other kids. So what we've been only doing is sending out our sitters to the family, to the home, to take care of the family so that the worker can come to work. And we have around the clock care. So the majority of our care is not overnight, but we do have overnight available. And what we do is we send the sitter out to the family's home and watch the children while the employee goes to work. Ideally, we would send the same person out every day to be consistent with the shift. We're trying to minimize the number of interactions that we've got. But it's what we're doing right now. And so we have coverage in Austin, Houston, San Antonio, Dallas, and Fort Worth. But I wanted to also make myself available to anybody that is not in those areas, because I do have some resources that I could share with you where you could get care out there. And I'm happy to just give you advice or suggestions of what might work for you. Essential workers, obviously your employees, your caregivers are essential workers. Under the governor order for the state of Texas, so are child care workers. So especially if they are caring for an essential worker. So in addition to that, the Health and Human Services Commission has put out some guidelines specific to on-site daycare, which, like I mentioned, is not super relevant right now, but if somebody did want to do an on-site pop-up daycare, we would do that. We would figure out how to set it up where it would be in compliance with the no visitor rule. And then there's some HHSC guidelines that we would follow. And it's common sense stuff that you're already doing right now. So we certainly can take care of that. What we would then do is we would then bill the employer and you would pay us for the child care, and the employee doesn't have to worry about that. Some people do a copay. We don't really probably have time in this crisis to figure that out, but I can give suggestions of what other businesses are doing through this time. We're waiving our enrollment fees during this process. So we normally have annual fees, whether it's for individual families who hire us or whether it's for businesses that hire us for backup care. So we're just waiving all that right now just to get through it. And one thing I wanted to share with some of you have more than 500 employees, but those of you that have fewer than 500 employees probably are taking out Paycheck Protection Program loans. And it's the opinion of our legal counsel as well as accountant that that in-home backup care paid for by the employer would count as payroll as part of the calculation for the forgiveness of those. So definitely you're going to want to check with your lender. The lenders are going to have discretion on that. But I wanted to make myself available just as a resource to any of you for whatever questions you might have. If you need care, what we can do. Yes, I just saw the question. So you typed in that same question. What you want to do, your lender is going to have a lot of discretion here. The SBA and the Treasury has not defined what is included and what is not. And so that's what we would need to do there. So that's really it. There are other options out there. I know that care.com just issued a press release with Governor Abbott around their referral service. So they're a referral resource online, and they're waiving their online memberships. So what you would do there is you would go into their database and you would grab people and you would hire them. The difference between that and my company is my company, the sitters that we send out, they are my employees. So they're my W-2 employees. We have onboarded them. We've run all the background checks, screening, everything. My workers' compensation insurance is applicable. My general liability insurance is applicable. And that's how we do it. I'm part of a network nationwide that has over 8,000 sitters. In Texas, we would, I don't know the exact number. I'd say it's probably close to 1,000. And we're really busy, but we are wanting to prioritize healthcare as well as nursing homes. And so if there's a need, would love to stand beside you and help you out. I'm gonna throw my contact information up real quick. I know looks like a lot of y'all don't have video, but I'm gonna share a screen here with that just so that you can see, and then we can go ahead and take any questions. Can you see that on the?
Yes.
Okay, good. So I've lost the chat room here, so I can't see the questions. What questions are there?
Okay, we don't have any. I actually have a question myself. In terms of sort of this protection, that's PPE stuff that everyone is wearing, are all your child care workers under that same order? Do you need to wear masks and all that stuff that everyone else is wearing? So
we're under the cloth mask rule. So basically bandanas or cloth masks, not the medical masks. You know, we can work case by case if there is a need for that. We wouldn't be able to get those masks is the challenge for us. So we have instructed our sitters to wear masks, just following the CDC guidelines. We've sent out videos of how to make them. We've also purchased bandanas that you can turn into masks, but we don't have the PPE masks.
Okay. What about, you said you carry liability insurance and all that stuff. So is there any risk to somebody hiring you?
So our liability insurance, that's a good question. We work with Fortune 100 clients. We're working with the major hospitals, like I mentioned, big companies like Exxon, Houston Astros. They have put us through their risk management process, and we have insurance. We could make our insurance available on request, where we could even list a facility as an additional insured on our policy. So it's significant. It's what you would expect. Our workers' compensation insurance is also significant. There still is some ambiguity around workers' compensation and COVID-19, just because it's so difficult to link an illness back to a specific job-related accident, but that wouldn't be your issue. That would be our issue to deal with.
Okay. Let me open it up to anyone who's attending now online. Do you have any questions? Are any of you providing childcare to your employees, and how are you doing it? Feel free to unmute yourself and talk if you'd like.
I'll just say, in answer to the question, I did receive guidance from an accounting firm that said that if you raise your employees' salaries, or if you increase your staff during the next couple of months, that could offset the payroll protection forgiveness plan. I'm not an attorney, and that's not legal advice, but I did see it. And
Okay.
so, check with an accounting firm or an attorney, because it may be that you can have that childcare reimbursed.
Thanks, Michelle. That's very helpful.
For those of you that can't see the screen with my contact information, again, my name is Stuart Dupuy, D-U-P-U-Y, and my phone number is 512-879-7509. Feel free to give me a call, send me an email, and happy to be a resource for you.
Just some comments from some members. One is saying we are partnering with employees to find a local daycare, and we're paying for the daycare services. This is our interim plan. So have you set up any, during this crisis, have you set up any on-site daycares at any employers in healthcare, that is?
No, we haven't. We've actually set them up in theory, and then the employees didn't use them. The employees asked us for in-home. So in-home is a little bit more expensive depending on the number of children are at home, but that's been the overwhelming preference from families, which is very different than Hurricane Harvey. And I guess people just don't want their children around other children.
Yeah, that kind of makes sense given the type of crisis this is. So, okay. If no one else has any questions, we will continue to gather those questions and send them to Stuart. He can answer those, and we can get those out to you. But we have some other issues to cover. So thank you, Stuart, for your providing a great resource to our members, and we look forward to working with you.
Thank you so much. I appreciate it. I will talk to y'all later. Bye-bye.
Okay, I'm going to turn it over to Elise. She has some updates from what's happening from state government. As you know, the federal government and state government has been putting out new guidance seemingly every hour. For those of you who have been on the LeadingAge national calls, it seems like a lot of this stuff happens overnight. So I'm going to turn it over to Elise, and she can give an update of what's happening within Texas. You're on mute. Let's see.
Hi, everyone. Can you hear me?
Yeah, that's good.
Okay. Hi, everyone. Hope you're doing well. I just wanted to point you to some recent updates. If you haven't seen them already, and continue to encourage you to check our resource page a few times a day as we're consistently making updates. Late last week, CMS issued new guidance for nursing facilities. Just want to draw your attention to that. HHSC also released a 25-page document specific to responding to COVID-19 in nursing facilities. So what to do within 24, 48, 72 hours, and so on. So I want to make sure members are aware of that. Tomorrow, the state agency is hosting an assisted living facility stakeholder call. Registration is posted to the resource page. I believe that is at 10 a.m. tomorrow. And then they will also be hosting a nursing facility stakeholder call on Friday. That notice has not gone out yet through gov.delivery, but I just received word while we were sitting here on this call. So we'll post that to the resource page, but also be sure to check your gov delivery. And I just want to make sure that everyone is subscribed to Texas HHSC gov delivery system. That is where you're going to be receiving the most timely updates and information. So if you have an opportunity to, and I'm happy to post the link on the resource page, but make sure you go through your subscriber, your fields, and you're subscribed to receive the updates that are relevant to you. We've been getting several questions from members related to the CMS blanket waivers that were issued. Those blanket waivers refer to the CNA training and competency, as well as designating and setting up specific isolation or COVID positive units within your facility. The agency is working to get all of those approved. Unfortunately, there is a process, but the agency continues to assure us that these blanket waivers and the other waivers requested by us and other stakeholders are moving. Unfortunately, they just have to get rubber stamped by a few folks at the agency and then head to the governor's office for final approval. So we're hoping to hear back and get approval on some of these waivers that everyone's been really curious about within the next week or so. I do just want to make a quick announcement, not COVID related specifically, but we just received word for those nursing facilities that are participating in the Quality Incentive Payment Program for fiscal year 2021. The state has increased that funding pool from $800 million to $1.1 billion, and we'll be focusing on infection control and that component within the program. So if you're participating in QIP, we did receive a large increase for fiscal year 2021 a few months ago, but the state bumped it up again. So that notice should be made public fairly quickly as well. And then wanted to just walk through some of the frequently asked questions that the state has posted with regard to nursing facilities. Corey McDonald put together really great response that he's been pushing out through Twitter, and we'll try to consolidate to get on the resource page as well, but want to turn it over to Corey to walk through some of those frequently asked questions.
Thanks, Elise. Everybody hear me? George?
Mm-hmm.
Okay. Yeah, I want to just go through some of the FAQs that HHSC put out over the weekend. There's some helpful information, and I'm just going through these in the same order in the document. one thing, and everyone should be aware of this now, is the requirement to self-report all actual and presumptive cases of COVID-19. One element that includes residents, staff, and visitors. So the visitor part probably is the hardest to think through. It also says that after you have, or this is also in the recording, it says that after you've had one report through Tulip, you don't need to do a full new report each time that you update. They did clarify that, this will not automatically result in an on-site visit at this time. It may, just like in any other self-reporting situation. They addressed in the FAQ the fact that residents are permitted to go outside into what they call protected areas, which are areas that are restricted to just residents and staff, as long as the folks out there are less than 10, so meeting the state 10-person rule, and then also maintaining social distancing. There was an FAQ about receiving visitors on the property outside the building. This is something that, I'm sure many of you had sort of thought through as people are really desiring to see their loved ones. Perhaps could you sort of set up a place outside where people can come and, interact with distance? The state is saying no to that. I got a question through Elise on this as to whether this sort of reaches to, prohibiting people from coming up to windows. And that was not how I read it at all. When I first read through it, after getting that question, I went back through and looked at it again. And I still don't think that this FAQ puts an obligation on you to sort of stop people from coming to windows. I do think it is suggesting that the windows should stay closed. But I didn't read this as again, prohibiting people from coming near windows. And I understand why people would want to do that. It makes clear that you shouldn't prohibit people from wearing masks. I don't know who's doing that, but that is not the right thing to do at this point in time. It says that if a resident tests positive, and just in general, if you've had exposure to staff, if staff has had exposure, it directs you to the CDC's guidance on categories of exposure. And so that's something people should get familiar with right now. I've tried to summarize it. It's not easy to summarize, and I'll share this with LeadingAge Texas and hopefully get it out there to everyone. But really, there is sort of a subjective decision that has to be made. When you've had someone in your facility, whether that's a patient, resident, or visitor that's a confirmed case, you have to kind of evaluate whether it was a low risk exposure, medium risk. People with low risk exposures, staff can continue working. They give you some elements to think of when deciding if it was a medium risk or low risk. Some of that is the duration of the interaction. Some of it, and probably the biggest thing, is whether people had masks on and other protective gear at the time. So again, this is kind of a case-by-case deal, but I see it as HHSC making clear that every exposure doesn't mean you can't work. And obviously if someone has been exposed, there's guidelines in terms of increasing their checking in with them about checking temperature and checking in with them about symptoms. They get into games, which I know a lot of folks are trying to do, and they don't go as far as saying don't play games. They basically say it's okay if it's less than 10 residents, that there's social distancing going on and there's good hygiene, hand washing, and so forth. The guidance clarifies that volunteers are not permitted at this time in nursing homes. One that leaves some discretion to the facility is in regards to end of life visitation decisions. The question is posed as, and it probably came from the standpoint of, does anyone who's on hospice get to have visitors? The state is saying no, that's not what CMS has said, that it's different from just being on a hospice. It's if it's an end of life situation, and that's really left to the facility to kind of determine what really is an end of life situation. Probably one of the most challenging items on here is admission of folks with, that have been at a hospital that has had COVID or would have interactions, at the hospital, or that they've had COVID. And this, they're really not saying, they haven't gone to the level that, I understand New York has, perhaps in their discussion of this. They're saying facilities should admit COVID-19 patients from the hospital if they can safely meet their needs, such as with adequate PPE, isolation rooms, sufficient staff. They do go on to use the word must, but again, it's all subject to having sufficient resources. One of the things the state said on the recorded presentation about this is just the importance of communication and documenting, if you're saying no, why you're saying no. I mean, I take that as something that could, potentially come back and bite you if you haven't documented well why you're saying no, or your efforts to kind of work with the hospital. They even suggest bartering from with the hospital over PPE, which is one of the sort of most stark elements of the part of the HHSC's discussion that I listened to. The idea that you would basically say, okay, we can accept this person if we get PPE, and they even go on to say, make sure you get it at the door before you let them in. So that's just kind of the reality of what we're dealing with. They give you some contact info for Medicaid questions. They talk about readmission. And again, here they don't go as far as saying if it's your resident, they go to the hospital, they have to be readmitted. I will say on the recording, they strongly suggest readmission is required if the reason for the hospital visit was not COVID related. You shouldn't assume they're saying that the person has been exposed to COVID at the hospital. They again are saying this is all subject to your ability to meet what they refer to as transmission-based precautions with that person when they come back. They say you should admit who you would normally admit. One sort of what I perceived as random, but I try not to assume that question, was that family members shouldn't do laundry and leave it at the door. Another thing they clarify is that you don't have to screen for temperature and symptoms, EMS workers responding to an emergency at your facility. They say that fire system maintenance will continue, and but you do screen obviously in that case for temperature and symptoms. And then one of the things that we've been talking about and that may present the biggest challenge for keeping COVID out of your facility or limiting it is staff working with multiple jobs. They don't say you have to have everyone only work at your facility. I think they know that's not realistic. They do strongly encourage, or basically say, you need to look at your local orders in your county. And an example of one of those orders is Galveston County, which in the face of, or in response to the Texas City outbreak, where most of the facility did get COVID-19, the county said any and all staff at the facility where an outbreak has occurred shall not work at any other long-term care facilities, and that the administrator shall keep a list of all employees who have worked at other facilities. So you do need to be keeping track of local orders of that kind, especially if there's a big outbreak at a facility in your county or city, then you can probably expect a similar order. They do suggest, HHSC that is, suggest in general keeping track of other jobs and obviously monitoring exposures that your employees facilities that your employees may work at, and of course encouraging everyone to wear masks. So those were the key items. I'm happy to answer any questions regarding those FAQs, and I will work with LeadingAge Texas to get concise summaries of them out.
Thanks, Corey. I actually have a question because I know at least one of our members has basically said or told their employees, you have to make a decision. You either work here or somewhere else, but you cannot work in more than one setting. From a legal perspective, and I know there's no way to, well, I don't know if there's any way to police that, but
Yeah.
is it legal for them to do that?
My understanding is that there's no legal reason why you can't do that.
Okay.
Now, again, I don't focus on employment law. I've been kind of getting a crash course, as a lot of attorneys have, because of the big role that plays in this situation. But I did push that question to an employment attorney who said it's really not a legal issue. Really, that attorney came back to practical issues like the one you just mentioned, George, about policing. And so my understanding is that yes, you could impose that sort of a policy if you think it's the right choice practically.
Well, I mean, just knowing what has happened in Texas, and then when it first started in Washington State, it was from people going between facilities, and that's when the sort of pandemic sort of started there and spread like wildfire. But I think restricting employees to particular, and I know some are even talking about restricting people to individual buildings within their campus. I don't know how practical that is, but for some it might be.
It does seem like it would be, yeah.
Okay, we had a question about, hold on. Have any facilities had volunteer or paid family members trained to become temporary nursing assistants? And I can take a stab on this, but I'll ask Elise and Corey to follow up. But from what I know, Texas has not relaxed the training guidelines for CNAs. So other states have, like California, for example, and I think people can go through like an 8-hour course there. And as long as they demonstrate competencies, they can be hired as a temporary CNA. Texas, I think it's moving through the system from what I understand, but I hope it doesn't last too much longer, because that would help a lot in terms of workforce issues if we had that. The other caveat I would say there is, and this goes across everything, is the lack of testing is a huge problem. The only way we can really control this epidemic is, and particularly in nursing facilities, is to actually have lots of testing available for staff and residents, but mostly staff, so that we can prevent some of this cross-contamination with other facilities, other buildings, and can really pinpoint where the spread is coming from. But it seems like testing is still a huge issue in terms of just availability within our member facilities. So Elise or Corey, do you want to talk about, am I correct in what I just said?
Yeah, no, you're correct. The FAQs did, further specify volunteers were not permitted and restricted from facilities at this point. Like George said, the state will likely play a role in determining guidelines for the temporary training of new CNAs and competency or demonstration of competency and what that looks like. Like George said, some other states have moved fairly quickly to get these approved, but Texas is still lagging a bit. But just to note, when the emergency declaration was made, HHSU did have the ability to waive certain CNA requirements. It allows a trained CNA that has not tested yet to continue working past that 4-month time allotment. So there are some current flexibilities in place, but but not the blanket waiver, which is one thing we're really hoping to see approved. I want to mention or really pose a question to the members on the line, because this came up a few hours ago related to testing, but we're curious if you as facilities are working to procure your own testing, what that looks like, and also how that's billed. We understand Medicare is covering the cost of testing for beneficiaries, but some members are hesitant to provide Medicare-related information to some of the testing labs or the folks that are offering testing, and they're worried about scams. And that's something I just don't know enough about. So I'm curious to hear from members if they're being either reached out to purchase tests, or if they're actively looking to purchase tests on the private market. Does anybody have any comments around that or info to share?
Just a reminder, please unmute yourself if you want to speak. All right.
No. I see one question. Crystal asked, does anyone have a moonlighting policy they would be willing to share with members on our resource page? If you do and want to direct that to staff and allow us to use it as a resource, we'd appreciate that. Another question related to states issuing orders granting healthcare professionals immunity from liability. Yes, we have recently submitted a letter along with several other healthcare associations through the Texas Alliance for Patient Access, TAPA, to the governor's office. That letter is actually available on our resource page, but we have requested immunity, and LeadingAge has also made that request at the federal level.
Okay.
I have another question since
Okay.
for going back to something I mentioned earlier related to setting up COVID positive isolation units or areas in your facilities. Interested to hear from members if how many of you have already done that, how many of you are seeking clarification or finding barriers to doing that. I've received several inquiries from members about how to best do this. So if anyone has a COVID positive designated area or unit in your facility in place and you feel like it's working well and want to share that with the group, we'd appreciate it.
Okay, I'm not seeing any questions or anybody wanting to comment on that. So I guess from what it seems like we have two camps of people or facilities. We've got ones who are doing everything possible to prevent a COVID positive case from ever entering their community and putting things on real lockdown. And others are preparing for a potential COVID positive case. If this is just me speaking, but I would say be prepared, because I don't know if there's any foolproof way of keeping COVID-19 out of your facility, even with every precaution. So I would counsel all of you to think about those isolation rooms or isolation wings or however you want to call them, but really prepare for those instances, because I heard again from out of state, from New York, that something like 80% of the nursing facilities in downstate New York have COVID positive residents in their facilities. And it's now, again, they were a little ahead of the curve. I mean, we're a couple weeks behind them. So gives us time to prepare, that they didn't have that luxury. That just sort of hit them before they even knew what was happening.
George, this is Cheryl Harding.
Yeah.
We have set up an isolation area because we had to close our adult day program. So we have set it up there. However, we are not accepting admissions. So this would only be if it were our own residents that either came back from the hospital needing that, or if we had a breakout in the facility. So we have set up with a couple of beds now, but honestly, it could handle a lot more. And we hope that would work. But as you know, we're all testing this.
Yeah. Okay. Good point.
And I do have a moonlighting policy that once I get it finalized with legal review, I'll be happy to share it. And we are just starting, well, we've been asking staff if they work other places, but we're just now telling them they can't work anywhere else.
If you,
Thank you.
thanks. If you look in the chat, there's some comments from people who are setting up units or within their buildings or campuses that are going to be used.
There's a question. Go ahead.
I was going to say that I'll just share that there was on the CDC's MMWR, I think, reports, there was a study of an assisted living facility in Washington that as soon as they had one positive case of COVID-19, they implemented the social distancing and high infection control procedures, and they were able to limit the spread. And so I'm just hoping that gives everybody some hope that it doesn't have to like go rampant through your building. You really can isolate it if it's handled well.
Good point.
Thank
Michelle.
you for that. And to that point, I will just share what is happening in Bexar County right now, but we may anticipate seeing in other larger counties. The local health departments and HHSC are collaborating to potentially identify and designate COVID-only nursing facilities. Some other states have moved toward this model, but we are finding that other states are having problems in moving toward a model that would not only, serve as a facility for hospital discharges that are COVID positive, but also to potentially transfer a COVID positive resident from one nursing facility to another. So I just want everyone to be aware that there is discussion on that, and probably within the next couple of weeks, we may see that happening across the state, but particularly in larger counties. And if you all are hearing from your local health departments or your regional program managers with HHSC on that model and how that would work, we definitely encourage you to reach out to us and share that information as you receive it so we can be aware.
So Elise, this is Kathy from the West Center. the United Way and the county judge in Tarrant County and the Area Agency on Aging, they are having that same conversation right now, as well as field hospitals for seniors with COVID. And they're really struggling with how do you do a field hospital for seniors with dementia. And so that conversation is happening in Tarrant County, but there are no answers right now. And so I can connect you with the people who are having the conversation, but they're really just doing that right now because they've been so focused on acute care.
Mm-hmm. Okay.
I also, while we're talking about protection and stuff like that, is Ann on the line? Ann Castro? I don't know if she is, but for those of you, she's our value.
I am. I'm
Okay.
sorry, I was on mute.
Okay. Do you want to give a quick update of what's going on with PPE? Because I know Ann has been able to find a few sources of PPE. And as you know, that's like gold these days. And takes a lot of prospecting, which Ann has been doing. And but it's tough to get, and I've been reading all kinds of things about the federal government confiscating some of this stuff that's going around. I know it's more of that is focused on hospitals, but as you know, our members need it as much or more than hospitals in some cases. So, Ann, do you want to give us an update of what's happening with PPE?
I sure can. I know some of you may have placed an order for some PPE product that was coming over from China. It was the KN95s, and that got cut up in the tug of war of the FDA. The source that we had switched over to the N95 mask, but that caused a delay. So I'm vetting out additional opportunities where we might have availability that's already stateside for masks. I'm also vetting out availability on gowns and hand sanitizer, as well as the face shields. So if there's a particular, also infrared thermometers, there's a source that's coming out for infrared thermometers as well. Also looking at opportunities that you might be able to buy in smaller order. I know some of the opportunities have been bulk orders that have been hard to get to that threshold. So I'm looking at any and all, but please feel free to reach out to me directly if there is a category that I haven't mentioned, because the list is expansive, and I would love to make sure I cover everything that you need.
Okay, thank you, Ann. I do want a couple of things I want to bring up. Next week, we're going to have a pop-up webinar. So we're going to have folks from Moss Adams talk about tax strategies and economic recovery for healthcare organizations. And they're going to cover some of the tax stuff, but also, you know, what the Family First Coronavirus Response Act, what sort of opportunities there are, some of the disaster small business administrative loans, and share some stories from some of their other clients and how they're planning on recovery from the huge economic impact this is having on their organization. So please plan on joining us next Thursday for that. And we are going to obviously continue these Tuesday at 1 o'clock calls as well, because it's a great opportunity for us to update you and also for you to share stories and information. That's the only way we're going to really get ahead of this, is by sharing best practices. One other thing I wanted to sort of poll the group, and I know this is a little out of the box thinking, but I just want to think about, you know, when we have our conferences, we have opportunities to share in small groups, or you know, at the bar after the sessions are over, people get a chance to really sort of unwind. And I know everyone's been under a lot of stress, so I want to suggest and get your reaction to whether, if we had one of these Zoom calls on a Friday afternoon say around 3 o'clock, would you join with a camera and just a virtual cocktail hour? We wouldn't call it that, but a virtual roundtable where we would just share how we're coping with this crazy time we're in. And so on your Zoom thing, there's a little reaction button at the bottom. So if you can give a thumbs up if you think that's a good idea, that will help us evaluate whether that's something we should pursue. Okay, got a few. Okay, well, we'll see. Some of you may be away from your computers too. They may just be calling in, but again, what this affords us, this crazy time, it affords us to be a little innovative and try things out of the box. And if they don't work, they don't work. But we certainly want to present an opportunity for you to get together, because I know a lot of you are working from home. Some of you are only in your facilities and organizations and don't get a chance to interact with people outside. So we want to give that opportunity to you if we can. Okay, question would be, would our therapy happy hour session be recorded? No, we would not record it. So, anyway, question, what's going on with the FEMA process? I've emailed the consultant group but haven't heard anything. We can follow up and see if we can move that along a little bit. I know they've been inundated because a lot of other LeadingAge states actually looked at our webinar and have contacted them as well. So they're probably inundated, but we will follow through with them. Okay. Any other last minute questions? Again, I will redirect you to our resource page on our website. LeadingAge National has a huge website as well with resources. They're having their daily calls every day at 2:30. Apart from our weekly calls, there are lots of resources out there. And we send our salute out to you for all those of you in the front lines and dealing with this on a day in and day out basis. And we're hoping that we can provide some resources for you in this remarkable situation we're in. So thank you all for joining us today, and we'll talk to you next week.